With us today, we have Denise Pimintel. She is the CommonSpirit Telehealth Network System Manager Clinical. She is a nurse by background and holds multiple advanced degrees in nursing and health information technology. Denise, welcome to the show.
Thank you, Will.
Thanks for coming. So let's start. I'd love to start with the origin story. Tell me a little bit about when you first started thinking about becoming a nurse and a little bit about your background in nursing.
Yeah, I guess I always thought I was going to be a veterinarian, and that moved on to nursing. I went to nursing school in San Francisco in the early 80s, went into the Army and became an Army nurse for a period of time. And while I was in the Army, critical care was my specialty. About 13 years ago, I began working for the prequel to CommonSpirit Health, which at that time was Catholic Healthcare West. And I participated as an ICU nurse in an EHR Big Bang event where we took 5 local hospitals live with an EHR. So we went into, design, build, and implement. From there, my interest in technology was sparked and how it could help what we do with patients and how we take care of them. So I went back to school in health information technology and got a degree in that so that I could learn more. My desire has always been to bridge clinical folks with technology to do our jobs more efficiently and to do a better job for the patients that we serve. So for 8 years, I've been with the telehealth network here, now CommonSpirit. And we consider ourselves a service department. So we bring physicians, services, and technology to areas of need, and we help them augment the care they're delivering.
What do you find is the biggest difference? And I've talked to folks before who have experienced this. It's quite different being a caregiver in the military versus being a civilian. What was that transition like for you?
It was eye-opening. The military has a lot of change and a lot of new blood coming in and has standardization across the board. And so coming into organizations where people hang out for quite a long time, culture is well seated, change is a lot slower, and resources are different. So it was eye-opening.
Well, tell me a little bit about 8 years is a long time to be in really one job and working in one area. Tell me a little bit about the CommonSpirit Telehealth Network.
Oh, yeah. So it's interesting because we began in 2008, and I was an ICU nurse on the floor and happened to be in the unit that was the recipient of the first robot that was rolled in at that time. And it started from the generosity of a grant from a local family who had a matriarch in the emergency room for a neurology condition, and the neurologists were 15 minutes across town. And out of their generosity, they just said, what do we need to do to get the neurologist closer so that anybody who needs a neurologist in the event of a stroke or any neurological emergency could actually have those specialists. And off we went. And, that's really the genesis of it. And it has grown significantly. We now do ICU services, neurology and stroke services, behavioral health services, infectious disease. We can bring specialists in just about any area of care to any one of our sites.
Denise, talk to me a little bit about how telehealth evolved at CommonSpirit during the pandemic. And it seemed, to us that, there was a growth of telehealth everywhere, but you already had a very well-established program. Tell me what that was like.
We went from being an established program that got attention when people needed us to all of a sudden everybody needed us. And the bonus of CommonSpirit is our size and our diversity. and our ability to leverage across that. We had different telehealth projects going throughout the US, not just the ones that the telehealth network supports. So the demand was spread across all of us. I would have to say that all of a sudden, what was seen as a niche way to deliver healthcare and the ability to augment people who really needed help became a vehicle that everybody wanted to use, whether or not they needed extra provider. It became, especially in the ambulatory care setting, when patients could no longer come in to the clinics, they needed to find another way to get the physicians out to the people, right, the patient. So that was, and us having contracts and experience and the knowledge to help educate, help scale these programs quickly was definitely a bonus.
Was there ever a point during the pandemic where you thought, like, my goodness, like, are we going to be overwhelmed, or are we going to make it? Was there ever any of that thinking going on?
No, we're a pretty, nurses are pretty resilient, physicians are pretty resilient. Um, and those early days of the pandemic, I was in the office 18 hours, 7 days a week. We just all, head to the ground. How do we solve this problem? How do we extend as fast as we can? Working with numerous different vendors who were also experiencing the same sorts of struggles we were, scaling rapidly, infrastructure being able to handle the scale, having the right patient access, having the right staff training, everything else. So, it was almost like being in the Army when we set up those mobile hospitals, right? Everywhere. And the difference is the learning curve was a little bit steeper, but hospitals and health systems have critical incident teams. So those teams stepped up and really helped with that as well. In the early days, it all brought us together.
Military experience has certainly served you well in ways you probably didn't expect. Denise, I noticed that CommonSpirit does an incredible amount of charity care and working and serving the communities in which its facilities are located. Can you talk to me a little bit about, are you involved, and does your organization serve some of those patients as well?
Yeah, I know that we do serve those patients. Like any hospital with an emergency room, that population does enter our system, and honestly, they're like any other patient. Whether you come in a mink stole or you come in homeless with only the shirt on your back.
Patients don't get that type of treatment everywhere, so I think it's one of the amazing things about CommonSpirit that that happens. I know we were talking about the pandemic earlier, and telehealth, but tell me a little bit about your organization's use of technology and some of the things that you're using to connect with patients and drive better care.
So technology, we obviously have electronic EHRs that we use. We have video applications that we use. We use secure texting applications across. We have patient portals. We have web pages that patients can, and apps that patients can follow, their pregnancy journey in, or whatever else they're looking to, their health in general. So there's a diverse amount of technology within the organization.
Specifically related to secure texting, how are you doing that? And are there any specific workflows that you've applied that to?
Yeah, we do use TigerText in parts of the organization. It's used provider to provider, clinical staff to provider, call center to a provider or a caregiver that needs to be contacted. We use it throughout acute care. I think we do use it in home health. when our nurses and caregivers are out in the field. It's really been applied almost anywhere you need the ability uh, to use protected health information to talk back and forth as caregivers about a patient.
So that sounds like that covers a lot of different workflows that you might have. What compared to prior to using secure texting and some of these other communication technologies, what's the difference now? What's the impact that you see?
So I think the impact is huge. So before you had to call the provider and have a live, real phone call with them, which meant stopping to find their phone number, calling them, interrupting them from what they're doing. They would answer the phone, then you'd have the conversation. Or you'd have to seek them out, or you'd have to email them and wonder, have they gotten the email? Have they seen it yet? What's happening? I don't have an answer. Moving to secure texting has been huge. It allows providers to speak to other providers. So, say a hospitalist wants to consult a specialist on a patient that he's taking care of. All he has to say is, can you please see Mr. X in bed, whatever, for I think he's had an MI or whatever is the thought process going on. The message gets sent at the convenience of the person sending. And when it comes to the recipient can choose to either look immediately, delay that look because he's in the middle of a conversation with somebody else, or pick it up, pass it on to somebody else if we have rules in it to escalate if he hasn't looked at it in 5 minutes. And what that does then is the sender, if 10 minutes later is curious, did I get a hold of Dr. X, can look and see, oh, he saw it, or, oh, it's been escalated, or there's like a closed loop in sending and communicating to each other.
Yeah, I love that transparency of communication, right? Instead of leaving a voicemail or sending a page off right into the ether, you know, getting that notification, oh, this person's read it, right, and give them a chance to respond. It's a much better feeling as a clinician, I think. So I agree with you. Have you talked to clinicians, nurses, or physicians about that feedback at all? Have you got any
Oh yeah,
feedback?
it's implemented in my workflows in the critical care area. So a nurse needs to get the critical care doctor on that device in that unit immediately. Um, they love it. They love it because from their computer at the bedside, Dr. Jones, I need you in this, boop, 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 right away. And 2 minutes later, he's in, and that nurse has gone on to do what she really needs to do with that patient. So, nurses, I constantly hear about it. And on the converse, when the schedule might have the wrong doc in it and the right doc didn't swipe in, I hear about it. They've become critically dependent on accuracy and being able to contact who they need. And like all human beings, once we get an easier path, when anybody tries to take that easier path from us or it breaks down, we're very vocal about that.
Denise, earlier we were talking a little bit about using secure texting communication to improve response time and how that's improved care. Have you noticed any other areas where this type of communication has had a positive impact on safety or quality?
Oh yeah, in the critical care area, definitely. Response times of providers to the bedside have significantly increased, or I should say decreased, meaning they get there quickly. The Safety wise, there are innovative markets that are videotaping safety messages or safety wins or risk avoidance things that go out to the whole market so that everybody gets to see it. And maybe it's a video and they hear the chief medical officer saying something about an issue, or it's a newsletter that reports what are our COVID numbers? How are we doing? How are our employees doing health wise? those sorts of things are innovative ways that I see it being used. We have the ability to notify code teams all at once via Tiger, because we set up a group and the code team gets messaged together immediately. It's really the innovative uses of it are endless. I mean, whatever you can think of, you can probably set it up and figure out a way to use that communication tool in a secure fashion within a healthcare system.
That's fantastic. Well, I'm glad that you and that CommonSpirit is getting so much benefit from TigerConnect, and that it's having an impact on your staff, on your patients. Well, Denise, we've taken up way too much of your time today. Thank you so much. You have delighted us with your presence here today and your perspective and your experience. Thank you very, very much for joining us.
And I appreciate the opportunity, Will. Thank you.